Mental Health First Aid Australia acknowledges Aboriginal and Torres Strait Islander people are the traditional custodians of the lands, seas and waterways where we live and work. Mental Health First Aid Australia pays respect to Aboriginal and Torres Strait Islander elders, past, present and emerging. Suicide is the leading cause of death for people aged between 15 and 44. And while suicide and suicidal thoughts remains a leading health concern for all Australians, Aboriginal and Torres Strait Islander people are twice as likely to die by suicide than non-Indigenous people. It is also estimated that for every death by suicide in Australia, there are 30 attempts made. Suicide is a serious public health issue that can have devastating impacts on individuals, families and communities. But due to the shame and stigma that often surrounds the topic, many myths and misconceptions still exist. Understanding suicide and suicidal thoughts can help foster a more compassionate and supportive environment and increase the likelihood of individuals receiving support and intervention when they need it most. This is where mental health first aid training can help. Most people are familiar with physical first aid and the idea that when you attend a physical first aid course, you learn the skills and knowledge required to recognise and respond to life-threatening emergencies and provide a first aid response to a casualty across a range of different situations. Mental health first aid training adopts a similar approach. Our courses teach participants about the different types of mental illness, and through our practical action plan, you learn the skills to recognise and respond to someone experiencing a mental health problem or a mental health crisis. Our range of Aboriginal and Torres Strait Islander mental health first aid courses have been developed and reviewed in consultation with Aboriginal and Torres Strait Islander people. This helps ensure that participants are grounded in social and emotional well-being from an Aboriginal and Torres Strait Islander perspective, giving participants the skill to provide mental health first aid in a culturally safe and informed way. This course equips adults with the knowledge, skills and confidence to recognise, understand and respond to an Aboriginal or Torres Strait Islander person who may be experiencing suicidal thoughts and behaviours. The strengths-based course ensures participants are grounded in social and emotional well-being from an Aboriginal and Torres Strait Islander perspective and is significantly tailored to include cultural considerations, protocols and yarn-ups. The course teaches participants how to recognise the signs and risk factors that often indicate a person may be experiencing suicidal thoughts. Participants learn about the barriers to help seeking, how to overcome these barriers, along with the local and cultural supports and resources available to someone experiencing suicidal thoughts and behaviours. The course also looks at the many myths and corresponding facts surrounding suicide. Using a practical, evidence-based action plan, participants learn how to approach an Aboriginal or Torres Strait Islander person they're concerned about and how to initiate a conversation about those concerns. They also learn how to offer initial support, how to create a safety plan, and how to encourage someone to get professional help or other supports. Research has shown that by attending a course, participants improve their knowledge and understanding about suicide, along with their confidence in providing mental health first aid. Empowering individuals and providing them with accurate information and dispelling myths helps create a supportive and informed community where individuals are better equipped to recognise and respond to signs of distress. This can play a vital role in preventing suicide and providing support to those who are vulnerable or in crisis. Developed through the expert consensus of people with lived experience of suicidal behaviours, caregivers and mental health professionals, the course considers local perspectives and experiences and utilises lived experienced stories and Aboriginal and Torres Strait Islander photography, film, and artworks. This representation matters and leads to better outcomes for those participating in training and the people they go on to support. This 5-hour course is delivered face-to-face by an Aboriginal and Torres Strait Islander mental health first aid trained and licensed instructor who can draw upon their own unique and instrumental local cultural knowledge to enrich course content and enable culturally informed and safe delivery. The course is suitable for workplaces, volunteer-based groups, and any adult interested in learning more about supporting Aboriginal and Torres Strait Islander persons who may be experiencing suicidal thoughts and behaviours.